my work schedule or whatever. So yeah.
Yeah, so it seems participation in general has been pretty challenging for this module.
Thank you, Andrew.
Thanks,
yeah, absolutely.
Andrew.
I'm not sure there's much more to go over here other than the
There is.
histograms, which are more.
No.
Histograms, those are more for yeah, detecting errors, and I think we may not even have enough data to detect errors.
Right.
Thank you, Andrew. All right, that's great. Okay, wonderful. Well, thank you, Dwan, for providing that update. And I got a message. It looks like Amy, you're on for Frontline. Can't hear you. Do you have a mic? Still can't hear you. It says you're unmuted, but there's no audio. Okay, she's gonna try dialing in with her phone. In the meantime, why don't we move on to the next group? Amy, when you're ready, just send a message through the chat. CAP Tulsa is the next group on the list.
Yeah, and I'm representing today. Ariane has another commitment.
Okay.
So with our father engagement, you want me to pull that up? We're kind of just in the beginning, so we're really working on doing activities with dads, and we're sharing an activity sheet with the mothers and telling them to then share with dad, and if dad is doing the activity at least one time during the month is what we're measuring, and hoping that that activity level will increase over time. And
sorry about that.
And so that's what we've been measuring. We have 5 different activity sheets, one for each month. The most popular activities that we've done so far was the box play, and we had a lot of photos and videos that families sent in with that. I think our October data is still coming in. So usually it's the beginning of the month that the parent educator is modeling the activity and then sharing the activity. If dad's available on the visit, of course, with them, but if not, doing it for mom to then share with dad. And then it's more later in the month that then they're following up to see if dad did have time to do that activity. And you all may want to do some more on the data, but I was going to just show this one of the tables with the biggest barrier we've seen so far was the time. And at our staff meeting on Monday, we talked, so kind of just like the previous program mentioned the exact same thing. So the time commitment and parent educator.
Uh-oh. Carolyn, are you still there? It cut out. I think we may have lost. Oh, okay. I think we may have lost Carolyn for a minute. The challenges of trying to do this right after an ice storm. I'll see if I can. Okay. So, oh, are you back?
Yeah, I'm back. Looks like it cut me out for a second there. So sorry. But yeah, if you have any other comments on the data, I will.
So you were saying that you talked to the program on Monday to the providers about the time.
Yes, yes. At the staff meet, we spent some time during the staff meeting with the 5 different parent educators, and they were sharing with one another kind of what they were doing as far as when they got feedback about dad not having time, and the ways that they talked to dad or the families about that, you know, it could be a time on the weekend, that it wasn't necessarily an hour-long activity, but that it could be, you know, a smaller amount of time, and just some different ways to incorporate that activity into the family schedule. And so we spent some time brainstorming that.
And you said that the box activity was the most popular?
The boxed one has been the most popular, and we've gotten some really fun videos and pictures back from families sharing some of the different ways. So there was kind of a variety of things that they could do with the boxes, from different stacking activities to, I think a popular one was kind of using it as a little car or a race car type thing. And so that kind of seemed to spark a lot of imagination. And I think one of the interesting things we'll see at the end of this, we shared 5 different activities for the 5 months. And I think it'll be interesting to see perhaps what we want to see it increase over time, but I think that there may also be a factor of some of the activities proving to be more popular than others, or kind of engaging dad's interest. And so I think that's another thing that we'll look for and could guide us as we share activities throughout the year with dad, of activities that seem to be particularly engaging to them.
That's great. Yeah, I think we may have talked about it with your program or one of the others, but it does seem like a lot of times the way fathers want to engage and play with their kids is sometimes very different than how moms want to engage and play with their kids. So having different activities that kind of spark some interest for dads and kind of go along the lines with their natural tendencies and their interests in terms of play with their kids could be really great to see at the end of this.
Right, and we noticed that in group connections, and that's one of the reasons why we chose the boxes and blocks, because last year when we did our project, it was about dad engagement and group connections, and blocks and box play both proved to be engaging to them there. And so we were kind of trying to incorporate that same, it seemed like the large motor and physical play activities for some of these activities as well.
That's wonderful. Well, thank you for sharing.
Thank you.
Amy, I believe, are you the analyst for this? Sorry, other Amy Treat. Do you have the dashboard? Is there anything else you wanted to talk about for that group?
I don't think so.
Sorry, my kids just decided to bust into the back of the room where they're not supposed to be. They got, you know, iced out of school, so we do what we can. Okay, well then we'll turn it over to other Amy from Frontline. Amy, are you able to talk now? Can we hear you?
I believe so.
Oh, there you are, perfect.
Yes, I'm here. So our project was to encourage father interaction, specifically through father-led and participated in family routines. So for instance, like brushing teeth, preparing meals, those kind of items. The goal is to increase the number of days that the father is participating. And we are seeing some improvements and increase in father participation. So that's encouraging. We have a challenge right now with a couple of families that the fathers, their involvement has increased, but they will be deploying before the end of our time frame. So it's going to kind of change the trajectory of our analysis whenever we have some fathers that are improving, but then they're going to go to 0 technically before the end. So that's something we're working through right now.
Wow, okay. Yutian, do you have the data dashboard for Frontline's program?
Yes, I do.
You want to show it? We can walk through the data they have so far.
Yes.
Thank you.
So for Frontline, we are trying to see how many items that the father figures is engaged according to the survey that we distributed for these father figures, as well as how many days that they can be more involved to take care of their kids. So this graph just show you for these visiting father figures, how many items that they being involved and engaged. It seems like it's very constant so far, and then we do not have the like the post test available right now. We only have the pre and mid. I guess by time we're probably gonna gather more for the third time visits of these father figures. In addition to that, this is how many days these father figures by average to engage in their daily routines. It seems like father figures perform quite well. By average would be around 4 to 6 days. It's a little bit increased recently comparing to September and August. And also this graph is just show how many materials, the fact sheet and the programs distributed so far. Again, it's quite constant since September. About 3 to 4 fact sheet has been distributed. There are also some disruptors we have to pay attention. These disruptors is mainly coming from the survey asking about the father figures. Are you going to be available, or are you going to be at home, or are you going to be able to complete a survey or not? So you probably will see 3 different colors of bars here, and so far we only got a data from these father figures response that they are not at home.
All right, great. Thank you, Yutian. All right, and then the last group we have for today is LCDA. Hi, Patty.
Hi. Our project was basically sending a welcoming letter to parents, and then on a monthly basis, a fact sheet of some sort, talking about the importance of the role or ways that they can impact the children's lives by just being present, eating with them, playing with them, that kind of thing. So as far as I know, we have, and we were just going to do it with newly enrolled families. So I believe it's 20 for PAT and 11, but I believe it's 2 more that they're going to be sent tomorrow. So in total will be maybe 13 days on the safe care side. So far, no problems. A couple of times we just had a letter that was returned. The address was correct, but we don't know why it was returned, so it was resent. So basically what we just get gathering an ETO is, have you sent the welcoming letter? And if you have sent anything else, any fact sheets or any more additional information. At the same time, the parent educators and the family support workers are having conversations with the mom. I mean, they know that this is going to be sent, and it's been sent to dad. So the letter is being addressed to dad. The name and the letter is dad's name and everything. So they just kind of having conversations of how important dads are and their role and that kind of thing, and that they're going to be getting this information. Just encouraging them maybe to, to be involved in activities. We're not asking, saying, do this, read this many times or anything like that. So basically the questions that they're answering are the questions that we have for the Learning Collaborative. So I don't know if they have questions, and if you want to show the graphs that we have.
Sure. Adam, do you have the graphs?
Sure, I can pull them up.
Thank you. Have you gotten any feedback, Patty, from either the families or the providers about how they feel this is going so far?
And I don't know, Cynthia, if you want to mention anything that the providers have said. I believe they feel that sending the letter to dad at least is kind of connecting with them, and that's what we wanted, to feel like that they're welcome, that we understand, like you were saying, that maybe not necessarily that we have parents. Sometimes we do a dad here and there, but I don't know with these new ones, because remember that these are newly enrolled families starting in when did we start this one? In September, I believe. So we do have some that they sit on you know, during the visits, but at least they feel like that they can, you know, address that with the letter, and yeah, you know, whatever they send them, that this is important and the information that we sending. So it's just giving them more opportunities to discuss, you know, their involvement, not just maybe in the visit, but in general.
Great, wonderful.
Any comments, Cynthia, maybe? Or Monica? I don't know if they hear more of the direct comments of staff. I see that she's there. Cynthia?
Looks like she's muted.
Yeah.
Sorry,
She's-
I'm having some connection issues. I'm on a hotspot, and so I freeze like every now and then. But as Patty was saying, we haven't really seen much because they're new clients, so we're barely building that relationship with them, and we're just starting to have conversations with them as they receive the material. So it's kind of early for us to know how it's going to impact.
Okay. And do you want to walk through the data so we can kind of see how it's looking so far?
Sure. Well, as they just mentioned, what her team are sending out both a welcome letter and also father material, father education material, which is this handout, and the welcome letter is obviously a letter sent to the fathers trying to invite them into the sessions. And so this is just looking at how this material was distributed over time to individual participants. And then again, as Patty mentioned, the main outcome of interest right now is actually the learning collaborative. So the learning collaborative metric, which is looking at father involvement. And we can look at this as both an overall average, and also we have this for the individual questions. And the data right now are kind of encouraging in that participants who have received handouts are scoring better in these specific questions. So these are looking at how father figure, how involved they are with child rearing activities. This is for one of two this is for parents as teachers, I believe, and Patty also oversees Safe Care, and Safe Care is actually not seeing as clean of a pattern between father material distributed as well as father material not distributed. So here we kind of see there's not as big of a difference between the two distributed and not distributed across their scores. Sorry, this is not the right. So this makes it a little bit more clear. There's a difference between the two groups that Patty supervises. So that to me is interesting, and it kind of encourages more questions to look into. But I don't think that would be as surprising to Patty.
I guess with PAT, they started to enroll families almost immediately in September, probably with Safe Care. We didn't have at the beginning that many new enrolled families. Then we brought in 2 new workers, and that's when we started seeing that. So on top that you have 2 new workers, and then you just also have to, you know, train that part of make it more the conversational that you're going to have with the families about this, you know, father involvement and all that. But I think it was just because we recently are enrolling the families for safe care. So maybe the timeline will show a little bit better results. So hopefully that will be the case. And we did have several new families, but they didn't have a father in the picture. So that's why, one has 20, the other one, 11, but I know that we're gonna be sending the letters of 2 more. So little by little, we're getting more and more families. So maybe that will show up later. So, but yeah, thank you, Autumn, because it was more of checking the answers that they have in the Learning Collaborative to see if that made any difference, or if they're getting more involved as time passes. That will be our best indicator.
All right.
That's the only thing I have.
That's great. I like the change. I know we made this change Adam after talking in the rounding call, having the distributed to not distributed. I mean, it really helps clarify whether there's any progress being made. And at least for one of the programs, it looks like it's pretty stark contrast between those who are getting the letter and those who aren't. So that's great to be able to see visually. So thank you, Adam.
Sure.
All right. Does anybody have any questions for any of the programs before we go on? I appreciate everybody's progress reports. Let's see. Okay. Well, what I wanted to do now is talk about the new data collection effort that's starting from our evaluation team, because I know that MIECHV is in its 10th year here in Oklahoma, and we've gone through several rounds of data collection over the years with kind of slightly different objectives, a lot of the same primary goals in terms of trying to improve child outcomes and reducing child abuse and neglect and improve family functioning. But with each of these projects, we have slightly different aims and goals that we're trying to meet. So I wanted to walk through the next round of data collection that we're starting is going to be gearing up this next month. So we'll be contacting both the providers and supervisors at times, as well as some of the families involved in home visiting, to help us address these questions and collect data. So I'm going to kind of walk through what to expect. The official start date for this next round, we basically label each of the new data collection efforts as a new number of MIECHV. So right now we're moving into MIECHV 6. And for that, the official start date was this month, so October 1st, and it continues for 1 full calendar year. So for the next calendar year, we'll be working on collecting both survey data and doing qualitative interviews like we've done in the past. And really the main change is that we're going to be having a new focus on developmental monitoring and promotion. What that means is that we really want to understand how parents view development of their children. What do they know about developmental milestones that their children should be reaching? Do they have realistic expectations of their child's development? How the programs are engaging with families around developmental milestones and promoting and improving development. And this promotional piece is really, what are parents doing and what are the programs doing to help parents support their child's development? So are they doing things like reading to the child, taking the child out on outings to get more enrichment, things like that. So it's always been kind of in the background of the work that we've done for MIECHV, but really it's now a renewed focus. There are 4 aims of this study, and I'll walk through them. The first is to identify the strengths and weaknesses of the Lemonade for Life practices, informing and motivating client engagement through the use of adverse child experiences and hope and resiliency science. So for some of your programs, you might remember this Lemonade for Life curriculum. And actually, we have some questions that we'd like to ask you about how that's being implemented, if it's still being implemented, and what it looks like in your programs. For this aim, we really want to do some qualitative interviews. So actually sit down with some of the providers and supervisors, as well as some of the families who have been involved, and talk to them about the use of Lemonade for Life, whether they found it helpful, kind of what were some of the best components of it, what were some of the challenges or barriers to using Lemonade for Life. So those will all be qualitative interviews where it's more of an open-ended discussion about people's experiences and views about Lemonade for Life. The second aim is to expand on our current efforts to evaluate current and new approaches to increase father engagement in home visiting. This is really, we're going to be continuing the online surveys that we've been doing with the home visiting moms, dads, and moms who are involved in WIC, but not in home visiting. So they serve as kind of a comparison. So families who aren't receiving home visiting, but are pretty similar in other respects. So we'll be collecting online data from them. It's all kind of self-report surveys that they can complete online, and we have data collectors who will help them through those surveys. All of those are still the same exact measures that we've collected for the last round of data collection. So nothing new, it's just really trying to get more moms and dads' responses on those items. Then aim 3 is the new aim around child development. So we want to evaluate child development outcomes and current developmental monitoring practices within home visiting programs. So these are also going to be online surveys with the same groups. So home visiting moms and dads, and then WIC moms as a comparison. We just added in, on top of the measures we're already doing with dads, we added in some developmental questionnaires to get at what do parents know about development in their children, and how are they promoting and trying to improve development and outcomes for their kids. So this is the new aim. Related to the learning collaborative and how this plays in January, when we have our next learning session, as we wrap up father engagement, we'll be starting this new round, and the new round will be focused on child development, monitoring, and promotion. So we'll also be coming up with new PDSAs surrounding these topics of child development, monitoring, and promotion. So we'll have a lot more information for you at the next learning session, but the idea is really to kind of end our work on father engagement and start taking on some new PDSAs around these topics. And then aim number 4 is to evaluate the effectiveness of novel home visiting promotional materials on recruitment and enrollment. So this is really, we're trying to expand and improve what we're doing in terms of marketing home visiting. So making sure that we're getting the information out there to the families that are eligible and could potentially benefit from the services that you all provide. So we're working on different ways of kind of pitching home visiting to families, how we're getting the word out there, what we're doing in terms of marketing to really try and enhance our ability to get families involved in these services. So those will be online surveys, and they'll only be with WIC moms. So moms that haven't done home visiting, to try and learn, why isn't it that they've gotten involved in home visiting? Are they aware of the services? Are they aware of the programs? Are there ways in which we can help engage them more so that they might try to utilize the services that are being offered? So one thing we wanted to do is just to kind of give everybody a moment to ask any questions about some of those goals and aims and provide any feedback, especially around the Lemonade for Life. One thing that we're going to be sending out in the next few days is a really super brief survey. I mean, we're talking maybe, I think, 4 or 5 questions, just to see from the supervisors, are you using Lemonade for Life still? What parts did you use, if you used it, and when you used it? How many families maybe perhaps have been using Lemonade for Life? We're really trying to get a sense of what that looks like in your program now and what it looked like in the past, so that we can kind of guide how we ask families about those services. So I'm gonna pause for a moment, and if anyone has feedback or questions, feel free to chime in.
Helen, in our case, even when the Lemonade for Life was brought into the picture and the training for the workers, a year before, we had one of our staff that went to the protective factors framework training, and she's a trainer of trainers. So we were already doing, you know, the ACE questionnaire and presenting some of these things, but more initiating more from the protective factors perspective. So in the beginning, we didn't really do much of the Eliminate for Life because depending on if you just want to call it Eliminate for Life, if you ask the families that will not know what to do, but if you ask them if they have discussed ACEs, if they have discussed the protective factors, you know, you will get better answers than knowing are they using the hope map or whatever. We use other names for it, but not necessarily the ones that are, you know, in the Lemonade for Life. So depending on how you're gonna be asking those questions.
That's really helpful to know. That's exactly what we're trying to figure out. So it sounds like for your program, really kind of broadening it out and talking about the ACEs part, but not maybe Lemonade for Life specifically, that they may not be as familiar with that terminology, but it's not that they didn't receive some of those same messages and discussions.
Yeah, especially the protective factors and a lot of things that Lemonade for Life has. So it was almost the same, but the way it was presented more of ACEs first, protective factors later on, and you know the hope map and things like that. And we started a little bit different. We're talking about the importance of protective factors, what kind of things make the family strong, blah blah blah. And then we were discussing, you know, how you know, doing the questionnaire and going forward. But we were just maybe presenting more first the positive things that we wanted to see in their family and what kind of things, you know, can affect that. And then that's when it was discussed the ACEs. So that would be great. And of course, we would love to know what kind of things are you considering for this new CQI and tracking child development, because maybe I have two programs and I know PAT does document, you know, milestones and they have specific things, but Safe Care module is a little bit different. So you're not going to have the specific documentation of milestones. They do ASQs and things like that. So depending on where that's going to be pulled, what kind of conversations you're going to have with the staff of the families, because that will vary according to the module that the people are using.
Yeah, that's a good point. So for this round of data collection related to developmental monitoring and promotion, we have our own in-house surveys that we're going to be using with the home visiting families. So it's really kind of what we'll do is we'll tie it to their home visiting participation. So tie it to, does the number of home visits and the level of home visiting involvement kind of predict what the parents know about child development? Does it predict how the children are functioning, some of the milestones they're hitting? So it won't be as direct as actually trying to pull data from ETO necessarily about development within the kids. We're going to do another round of data collection next year that will have some qualitative interviews with families and providers around child developmental monitoring and promotion, but that won't start until the following year, so September of 2021. But for now, we'll just kind of do these online surveys so we can kind of map that onto home visiting involvement. Thank you for that feedback. That was helpful, Patty. Do other people have thoughts?
Helen?
Yes.
Helen, this is Yolanda. Can you hear me?
Absolutely. Hi, Yolanda.
Oh, hi, how are you? I'm sorry, I don't have internet or electricity, so I'm trying not to lose connection with my phone.
Well,
If
thank you
the
for being on
Lemonade
the
for
phone.
Life is going to be, well, luckily I have been, you know, being able to listen for most of the meeting, but if Lemonade for Life, are there going to be another training offer, or how are we going to do that?
You know, we were talking about that, and Lana Beasley, who has done that training in the past, she thought that if it would be helpful that we could talk about offering that again, because that was one of the reasons she also wanted to get more feedback about what's going on with Lemonade for Life, because she had thought perhaps it would be helpful to do another round of training for programs who maybe aren't implementing it currently or would like a refresher. Is that something you'd be interested in?
Well, the thing is, when we did, and we did a project, I think like 3 or 4 years ago, and we took a training, but I have a pretty pretty brand new stuff. So I just want to make sure the training is going to be offered, or the people that took it, they have to retrain again. It's just, don't know how it's going to go.
Okay.
I do have also new staff that, never had that training. So that would be helpful if we're going to be talking about or using this language. So that would be helpful.
Okay, good to know. Dwan?
Yeah, that was going to be my feedback, because I would say over half of my team, when this starts up at that point, over half of my team would not have even have heard of Lemonade for Life or had the training. So even right now, I only have 1.5 providers that have been through the training. So the families probably won't know, to kind of stem off of what Patty said. If we said ACEs and things like that, families would understand that, but maybe not Lemonade for Life.
Mhm. Okay, that's helpful.
Same goes with Creoks, with us being new.
Yeah.
We would definitely need to be trained. I've heard about it, but I don't know the ins and outs of all of it. So that would be great. There would be 3 of us.
That's a really great point. Actually, in the discussions that we've had so far about the Lemonade for Life curriculum and kind of guiding some of our questions as we put together these interviews, we did not think about staff turnover. We had talked a lot about how long it's been since some of the home visiting families may have received these services, but we didn't even think about the level of turnover that may happen at the provider level. So that's really something we'll have to think about as we gear up for data collection in terms of who we ask to participate in interviews. It sounds like perhaps rather than kind of the more structured Lemonade for Life curriculum, that programs may not be using that as closely as maybe the initial training suggested, but there are discussions happening within the programs around ACEs. Does that sound right, that programs are using kind of the verbiage around ACEs and maybe even using the questionnaires and talking about it, but not specifically calling it Lemonade for Life? Do people have thoughts on that?
Helen, I don't. Okay, in the past years, or when I guess we started, it feels like there was a big wave of talking about ACEs, and the CQIs actually were focusing on that. And so I think that after that pass, we implement a little bit of the Lemonade for Life, but also the staff, because it was just required for MIECHV, so the Parent Child Center did not get involved the other part of the staff necessarily, not in the same way. And I think that has going away a little bit, right? It's not that intentional as I think that it could be beneficial. In the past, we used the brain video, and that was a really good hit with our clients. We use the ACEs questionnaire, and we use like the hope map. Actually, we even implement that later to help completed goals. And for some of the parent educators was really good, including me when I was still having clients or seeing clients. It just make so much easier, makes sense for my clients. And I see them attain more goals, complete more goals, that using the other resources, that we have been taught and try and all that. So it seems that it click faster. So I think that a refresher also for my team will be good. We have also one parent educator who has never got it. I think that it would be a good thing. And anyway, that's it, I guess.
Thank you. That's really helpful. Were there any other programs? I think I pretty much everyone, but was there anyone else who wanted to say anything regarding the Lemonade for Life or ACEs program?
Helen, I would like to say something. This is Sherry with Safe Care Parent Health Center.
Yeah.
We use the ACEs at intake now, and we also use the Brain Builder video
when we begin either PII or PCI modules with our families. We
Okay.
kind of, and we will do that also at intake. So we do it like twice. But I also have new staff.
Mm-hmm. Okay.
So yeah, a refresher would be good.
Okay. Okay, this is really perfect feedback because I know that we were really kind of unsure as to where everything landed, but it sounds like it's pretty consistent across the board, which is there have been some elements that were implemented. Most have kind of stopped, but there's still a little bit of involvement going on in certain programs. There's been a lot of turnover in staff. So a refresher for those who already had it, but brand new training for a lot of the staff would be helpful. And that if we are going to do these interviews, we need to really broaden out our language and how we discuss it to make sure that it's clear when we talk to providers and to families, because the Lemonade for Life label might not be what clicks for providers or for families. So thank you. I really appreciate it. We will still send out, there is, let's see, another, for some reason it's frozen. There we go. This is the link. We'll send it out in an email just in case people have additional feedback, or if the supervisors, if there's anything else you want to talk about regarding Lemonade for Life. You're also welcome to pass it on to other people who weren't able to make the call today. And that way we can make sure that everybody gets a chance to weigh in. But I think based on the feedback that I've heard today, it will really help us create more useful interviews, as well as I will have a discussion with both David Bard and Lana Beasley about an additional training and what that would look like and how we can make that happen, because it sounds like that could be really helpful across the board. So thank you. In the remaining time that we have, I wanted to just present a quick talk about some of the findings. Like I mentioned at the beginning of the call today, for those of you who are on at the beginning, I'm actually going to be giving this presentation to a group of MIECHV evaluators. So these are all people like myself who are working on the research side of things, who are kind of working to evaluate these programs and see what kind of effects are we seeing for the families. So the title of this talk, it's rather lengthy, is Putting the Home in Home Visiting, Evaluation of the Mediating Effect of Home Environment on Child Development. And some of the language in here is a little bit technical because it is geared towards a pretty research heavy audience. So I'm going to kind of back out of some of that language and clarify more, because I know that people have varying levels of experience with some of the more technical research terms. So I wanted to start with a discussion about the history of MIECHV in Oklahoma. I know for this audience, that doesn't really make a whole lot of sense. But for those of you who may not know, MIECHV is in its 10th year in Oklahoma, and the University of Oklahoma's Health Sciences Center has served as the external evaluator for all 10 years. And the models selected for implementation under MIECHV in Oklahoma include the Nurse Family Partnership Program, which is referred to as Children First, or C1, Parents as Teachers, and Safe Care. So NFP, Nurse Family Partnership, has been, oh, sorry, my computer's having issues, has been operating in Oklahoma for 22 years and has state funding that has been provided and is administered by the Oklahoma State, sorry, there we go. Sorry, technical difficulties on my other computer. Administered by the Oklahoma State Department of Education for PAT, sorry, that's for PAT, and is now being implemented by the Oklahoma State Department of Health. And PAT also has state funding and MIECHV funded sites. Safe Care is actually facilitated by the University of Oklahoma through our Center on Child Abuse and Neglect, and receives MIECHV funding. So this strong, consistent history of MIECHV and home visiting more broadly is particularly crucial in promoting well-being and health of children and families in light of the high-risk nature of a sizable portion of Oklahoma's population. So when you look at Oklahoma, we're a little bit unique in how our children are faring. So Oklahoma's children are among those at greatest risk for ACEs. At least 10% of Oklahoma children experience 4 or more ACEs during their childhood. Oklahoma was the only state that fell in the highest prevalence quartile for 8 of the most commonly assessed ACEs. So really, I mean, pretty striking adversity exposure for a lot of the children in the state. And so perhaps not coincidentally, Oklahoma ranks among the worst in the nation on health conditions associated with high levels of ACE. So when we look at long-term functioning of the children and what that means even across the lifespan as they age into adulthood, it's these adversity experiences are being linked with poor health outcomes. Recently, Oklahoma parents were surveyed about their children's ACE exposure to get really at what types of exposure the children have. And what the study found was that 30% of parents reported that their children experience economic hardship, which is ranking Oklahoma 45th in the nation for that outcome. And as you can see across the board, I mean, 30% for divorce, 17% for parents abusing alcohol or drugs, 11% witnessing domestic violence. And what's particularly striking beyond just the percentages is if you look in those parentheses and see where Oklahoma ranks nationally. Across the board, they are ranking at the very bottom for child developmental outcomes. And this has important implications, as I mentioned, for long-term morbidity and mortality for individuals across the lifespan. So when you look at these high rates of ACE exposures, it really impacts how long these families are living. So when you look at Oklahoma, right in the center, what you see is that for life expectancy for 40-year-olds with household income below $28,000, they are having significantly shorter lifespans than other states. So in other states, it's really not impacting them as hard. And you're not seeing kind of the fallout from being low income that you're seeing in Oklahoma. In Oklahoma, it is actually reducing your lifespan to be low income. And this is another depiction of kind of that same finding. So if you look at where the poor live the shortest amount, Tulsa and Oklahoma City, unfortunately make those lists nationally for both men and women. Women in particular, it's pretty striking how high Oklahoma City and Tulsa are ranking in terms of that poor outcome for families. So all of this is to say we need to move the needle. How do we improve these outcomes for children and families? And home visiting has some strong research support overall, but the findings are really mixed in terms of how home visiting changes child developmental outcomes. So some studies have found that participating in home visiting really predicts improvement in child development. Other studies have not found that. So one potential reason that the findings are kind of mixed and we're not quite sure how home visiting impacts child development is that home visiting indirectly affects child development by changing the home environment. So I'm going to walk you through kind of a model of what that means. So we have seen from research studies that home visiting improves the home environment. And this, I mean, it really makes sense if you think about the types of programs that we have here in Oklahoma and the curriculums that are being used. So when you think about Safe Care, for example, there are specific modules on improving physical safety in the home, the health and medical needs of the child, and the overall parent-child relationship. So by emphasizing these areas, it may lead to alterations in the home environment, meaning that the children may experience more emotional warmth from their family, more emotional connection from their family, and they may also receive kind of overall a more cognitively stimulated, a more enriched environment after participating in home visiting programs here in Oklahoma. So here's where we get into stats, and it's a little stats heavy, so I apologize. I will try to be very clear as I walk through this. When findings are at times mixed as to whether home visiting directly improves child development, one thing that we wanted to look at was maybe there is this indirect effect. So this is what's called a mediation model. What it basically means is you have some kind of predictor X, which you can see in the box below. X in this case would be home visiting. So we know home visiting is happening and we want to know, is it changing Y? In this case, Y would be child development. So you can look at that direct pathway, which is depicted here as C. And for C, the direct pathway would be, does home visiting by itself change child development? What it may be is that it doesn't directly change, but that it in fact changes by changing something else. So in this case, home visiting would change M, which is the home environment. So by participating in home visiting, we would improve the home environment, and that improvement in the home environment is actually what changes child development. And this is called testing for mediation. And it's really critical for applied research. So research that's focused on the prevention and treatment of public health issues. It helps us identify the key ingredients leading to more efficient intervention. So if we know that the home environment is what's helping to promote healthy development in the kids, then we can really make sure that the programs are focusing on changing that home environment, really honing in on that aspect. And this really allows us a way to understand the mechanism. So the cause, how does home visiting cause change? And also kind of on a more statistical, methodological viewpoint, you actually don't need such a large sample to test for an indirect effect. So when we do a mediation test, we don't need thousands and thousands and thousands of participants to be able to test for change through this mediation pathway. But if we were just testing the direct pathway from home visiting to child development, we'd actually need a much larger sample. So in these studies where we don't always have thousands of participants, we might have small groups, especially, you know, if you're looking at the program level, some of the times the groups are very small. This allows us to have more kind of statistical power to find those differences, to see what's happening with our families. And overall, this mediation model that I'm showing here can also occur when the overall program effect is non-significant. So again, when we see that home visiting is not predicting, not changing, at least seemingly, the child developmental outcomes, we can actually still test for mediation and find that it in fact is making a difference. It's just making a difference indirectly. So in this present study, what we did was we aimed to test whether home visiting services led to improvements in child developmental outcomes through enhancements in the home environment. And these data collection efforts, we pulled together all the data that we've collected over the time that we've been doing MIECHV. So we have data from all of these different counties throughout Oklahoma, and we have data from all the different programs that we have here, all the different models of home visiting. And by doing that, we actually were able to get a large sample. So in this set of data, we had over 3,000 families who participated. And of those 3,000 families, 40% of them had children who were girls. And you can see the ethnic and racial makeup of those participants, which we've depicted here. And you're probably familiar with some of the questionnaires that we've used. So we use the ages and stages questionnaire to get at child development. I know that's commonly used across the programs. And we also had the parents complete the home observation for measurement of the environment. And it's a self-report, it's a short form of what the home environment looks like. And then to understand home visiting participation, we pulled ETO data and data from the Oklahoma State Department of Health to see how often families were participating in home visiting. So not to scare anybody off, but essentially what we did is, if you look on the left, we had home visiting count. So how many times did families participate in home visiting? So how many sessions did each family have? And does that predict the home environment? And we had two key outcomes for the home environment that we were looking at: the emotional support that families were providing and the cognitive stimulation that families provided. And then we looked to see that home environment, does it predict each of these child outcomes. So how the child communicates, their gross motor skills, their fine motor skills, their problem solving abilities, and their personal social skills. And covariates means essentially we accounted for the fact that these families, that there were some other variables that might be important. So things like race and income and adversity exposure on the part of the parent, education, household size, marital status. So we included all of those to make sure that that wasn't explaining part of the differences that we're seeing. So when we examined this and we conducted this mediation to see these associations, here's what we found. So overall, when we tested the direct effects, so home visiting, predicting child development, we didn't find any significant outcomes. So home visiting was not directly predicting child development, but it was predicting home environment. So families who engaged in more home visiting had reported more emotional support in their family and also more cognitive stimulation for the child. So cognitive stimulation would be things like having books in the home, going on outings with kids, things like that. So these same things we were talking about for developmental monitoring and promotion, this is what we're capturing here. So parents really trying to improve their development of the children. And those home environment factors then predicted child development. So for emotional support, home visiting led to more emotional support, which led to greater communication skills on the part of the child. But that was the only thing it predicted. But cognitive stimulation actually predicted every single outcome for children. So more home visiting led to families having more cognitive stimulation in the home, which led to greater communication, gross motor, fine motor, problem solving skills, and so personal and social skills in the child. So really having a pretty dramatic effect across all domains of child development. So the main takeaways from this study are, first, that testing for mediation can shed light on the ways in which home visiting impacts families. So if we just examine the direct effect of home visiting on child outcomes, we may miss important findings. It may look like home visiting is not working, when in fact it is working in important ways. So in applied research, like the evaluation of home visiting, we're often kind of challenged by small sample sizes, and it can make it very hard to detect significant effects. And it may not feel like we're moving the needle very much on these crucial outcomes. And there are some research suggesting that that's what's going on. But in fact, findings like these that we presented today show that we may be improving child outcomes more than we think, but these effects are indirect. Moreover, by conducting these mediational analyses, we begin to understand the key ingredients of our intervention efforts. So the findings here suggest that one key ingredient is the home environment. If we tailor home visiting curriculum to further promote the environment of the home, and especially the emotional support and the cognitive stimulation provided to children, we may be able to see more improvement in child developmental outcomes and have greater yields in our prevention and intervention efforts. So those are some of the key kind of takeaways that we got from this work. And I just want to thank you for listening, and I'm happy to take any questions. I hope that was somewhat easy to follow. So if anybody has any questions or would like to talk about it, please feel free to chime in.
Well, thank you for presenting that. I would like to have, if you can share that with us, I think you had a wonderful information.
Sure, absolutely.
So you said that the study, these results are showing a research of 10 years, is that correct? Or
pretty much. So we use the data, again, we label our MIECHV studies MIECHV 1, 2, 3, all the way down, we're now at 6. So we pulled data from every single data collection effort that we have done at OUHSC so far with MIECHV. So it is spanning about the past 10 years. You're muted, Patty. I don't know if you were.
No, I said that's great. So is this going to guide then what you're expecting from us from the next CQI? Because you were saying that, being more I guess, in terms of the home environment or changing that to see the outcomes and child development? Is that what you're gonna take in consideration in order for us to, I don't know, have better CQIs for the next one?
It's one of the things we're going to be thinking about. So we have a couple of different areas that we want to try to think about for areas of improvement as we do this next CQI. So this would be one of them. So thinking about potentially how to improve, especially that cognitive stimulation piece. Are there ways in which parents can really try to promote cognitive stimulation in their kids? There are lots of studies showing that early adversity, specifically certain types of adversity that a lot of the families that we work with are experiencing, those types of kind of deprivation and the kind of lack of cognitive stimulation has pretty profound long-term impacts for the kids. And so I think being able to focus in on something like cognitive stimulation and trying to promote, and these are some things that your programs are already doing. So if you think about it, one of the main things for cognitive stimulation is our parents reading to their children. And I know we have PDSAs going on right now related to things like reading to children. So it's just really kind of trying to find new and novel ways that maybe we can help families think about development in their kids and ways to help provide these stimulating, enriched environments in ways that are feasible for them, that maybe aren't going to cost them a lot of money or put a lot of undue stress on families who are already dealing with a lot of challenges, but just small, meaningful ways of creating change. So those are some of the things we're thinking about.
Because I think you're right. I mean, many times, well, I've been in this work 27 years. And one of the things I have noticed is because it's true, it's happening in the home visit. Is, you know, they're reading more, the activities that they bring to the children, they're really stimulating all these areas of development. I think that maybe where we fail is how we are documenting this. You know, how are you, you know, what, I don't know, whatever you're pulling information or the data that we collect, sometimes that is not showing there. So I don't know. For example, whenever Safe Care came into our agency, I could tell that it was easy the way they were collecting information, for example, for one of the modules, knowing if the house environment was safe. You know, they can count hazards before, and then they will teach the parent, and they will install things, you know, all the safety devices in the home. Then they could, you know, they could show that if it was 1,000 hazards, and then you went down to, you know, 10 or whatever, that maybe you can get to it. But it was easy, and then the data was easy to show that. But then with our programs, with PT, at that time HFA, it was hard to prove those things because it was not as, I don't know, the way it was being collected, it was not helping us show that. So I don't know. I don't know if you get what I'm trying to say, that maybe.
Absolutely. Yeah, I deal with this a lot in the research I do. My area of expertise is how adversity impacts children's emotions, and emotions are really messy and they're really hard to measure. And when you think about parents trying to understand how parents are interacting emotionally with their children, it's really hard to measure and to get a good sense of, are things changing, are things improving? So that's one thing that we'll be thinking about as we move into this next CQI is, can we think about ways to really capitalize off of what is going on in the home visiting curriculum already? There are lots of ways that the providers are trying to promote cognitive stimulation in the kids, trying to promote healthy emotional interactions between parent and child. And some of that's probably not getting captured, like you said. It's not getting captured right now, you know?
For example, when we added the Piccolo, Masa was super excited because as we're talking with the families, and then we saw the first interaction they have, but that you are teaching them and even showing them, you know, when you do these things, that's what helps or whatever. They see that improvement and the next ones and the next one. But I don't know if we have ever seen that analysis in ETO of the Piccolo observations, that they're already in there. The staff is saying, I see it, but I don't know if we are able to prove it, or how are we using that data to show that is impacting the way the families are interacting with the children and how they're stimulating the children. And that would show you the better outcomes as well. But I think that we're collecting things, but I don't know if we are using them the way we should.
Yeah, no, that's a really good point. And that's something we'll think about as we move forward. If there are ways to utilize the data that's already being collected, and is there anything new that maybe we should collect so that we can to get at some of these changes that are happening, and have real kind of evidence for change that we don't have right now. So that's a really good point. Thank you. Do other people have thoughts or feedback, questions?
Just one thought that's kind of coming to me of the impact on COVID and how that will play out in data in the future. And of course, I'm sure it is increasing the hardship on families in so many of those different areas, but also a factor with our particular work of doing these virtual visits. There's many added layers of difficulty to that. But one positive that I've heard parent educators mention is that sometimes there's a temptation for the parent educator to come in and kind of do that interaction with the child and leave, and it kind of being focused on the parent educator and the child. And in this virtual world, it totally has to filter through that parent. And so it will be interesting to see if maybe there is a little bit of that in a positive way of
I think you cut out again, Carolyn, but I think you're making a good point around maybe for the virtual home visits, almost requiring a level of buy-in and responsibility on the part of the parent, because the provider can't do the same things that they might do if they were in the home. They can't go directly and interact just with the child, that there has to be that interaction with the parent. So we will think about that as we kind of start putting together the measures that we're using and the ways in which we're asking these questions. Other thoughts or feedback, questions? Okay. What I wanted to end with is just some quick kind of administrative housekeeping items. So I really appreciate everybody taking the time to be on the call. I know it's been incredibly challenging the last few days, and that people are dealing with, on top of everything else that was already happening, dealing with these power outages and damage from the storms and all of that. So I really appreciate people taking the time to be on the call today. We have recorded it, so we'll share it with everyone as we move forward. What we're going to be doing in the next couple of months. So we will start doing some qualitative interviews and some survey interviews. The survey interviews will all be with the clients. They won't be with the home visiting providers. But some of the qualitative interviews those will likely gear up more at the start of the new year. So I don't think you'll be receiving any calls too soon on that. In the next month, we're going to do some more. Sorry, my daughters are writing me notes. We're going to be doing some more rounding calls, and we'll also do progress reports at the next call. So in terms of who's up for progress reports, we have PCCT PAT, Safe Care Tulsa, OKCPS PAT for progress reports, and PAT Parent Promise. And we'll do rounding calls with OKCPS, PAT, Parent Promise, Bethany Public Schools, and Creoaks. So those will be like we've done before, just checking in, seeing how things are going. We'll check the data, make sure everything makes sense. The core measures and individual PDSA reports will continue to be delivered each week, usually around Thursday or Friday. And also, I just want to note, in terms of timing, as we kind of wrap up the end of this calendar year, we'll have a monthly call in November. We're going to try to aim that for right before Thanksgiving break. So November 19th, 20th, 22nd, 23rd, or 24th, ideally. And then We'll do a December monthly call, hopefully in mid-December. This is really to help prep for the learning session presentation. So as we are doing our learning session in January, we wanted to have a quick monthly call to at least get people prepped before everybody leaves for the winter break. So there'll be polls coming out for those, but those are kind of the next thing that we have on the agenda, and that'll take us through the calendar year, and we'll start again in January. So we'll also be sending out information for the January learning session to get that scheduled. We are pretty much at time. Does anyone have any questions before we wrap up?
No questions.
Okay, well, thank you everyone so much for participating today, and I hope everyone has a safe and hopefully dry and event-free weekend, and enjoy Halloween as much as possible in these challenging times. But thank you so much.
Thank
Bye.
you.